Hi, I'm Stephanie Wolf, the leading sexual wellness expert here in Studio City, California at the Novus Center. And today I'm going to tell you the truth about Peyronies. Are you experiencing a curve or a pinching, perhaps an hourglass to the shape of your penis? Are you having pain with erection? Are you even able to have intercourse? I'm going to be discussing Peyronie's disease. I had a patient come into the office just the other week, and he wanted me to let you know that you are not alone. We get it. There is no one that you feel comfortable talking about this disease with. You're not going to talk about it with your wife, your friends, your family, and you have a very difficult time even opening up the conversation with your healthcare provider. You feel ashamed and you're not sure why. Well, I'm here to tell you this disease will only get worse. So please do not put your head in the sand and hope that it's going to go away, because it is not. In this video, I will tell you the truth about Peyronie's. I'm going to give it to you straight because I want you to know that I am here to help you, and I believe you deserve to know the truth. So what is Peyronie's? Peyronie's is where you develop scar tissue or inflammation, or some patients will actually get a marble-sized cyst just underneath the skin of the penis, which causes a bending to the penis. And once this bending occurs, there will be pain with erections, pain with intercourse. Some patients aren't even able to have intercourse because of the bend in their penis. This can happen because of trauma, both mechanical and sexual, whether that's a boxer or an MMA fighter, or perhaps it's just rough masturbation, or maybe your partner landed the wrong way. But I've also had many patients who will just wake up in the morning with this painful curvature to their erections, and they don't know why it happened. They don't know what happened. Well, I'm here to tell you, it doesn't matter how you got Peyronie's, whether that's you being a boxer, whether that's you having rough masturbation, or you just waking up one day, because the treatment is all the same. So we need to just move along why this happened and actually start treatment. What I've realized in all my years of Novus is that Peyronie's is very difficult to treat. There is no cure for Peyronie's. It's only managing the symptoms. And these symptoms will have to be managed on a maintenance program. I have to give you this truth about it because this is exactly what it is. I want you to think about it like a linen shirt. If you've ever had a linen shirt, you go to steam it or iron it, but you know that it's never going to be pressed exactly as a cotton t-shirt would be pressed. It's gonna still have a couple little wrinkles in there, but you don't mind and you wear it because you like it. And you know that once you wash that linen shirt, you're gonna have to press it again, and you're gonna have to iron it again, and it's gonna get wrinkly as the day wears on. I hate to be the bearer of bad news, but I wanna tell it to you straight. I want you to know the truth about Peyronie's so that you can take charge of your own health. We must find a new normal for you. And what that normal means is that maybe the bend is less, or you're free of pain when you get the erections, or that you're not seeing that atrophy of the tissue, or that pinching, or that hourglass to the penis, and that you're actually able to have intercourse. That's what we're looking for. And these are the questions that I ask my patients every time I see them during treatment. How are we doing? How is your pain? Are you having intercourse? Do you actually see that blood is filling up the tissue symmetrically? Those are what we're striving for. You will never be without that curve because that scar tissue is always going to want to come back. Another disease that's very similar to Peyronie's is something called Dupuytren's contracture or trigger finger. If you've ever heard about trigger finger, or maybe you haven't, this is where patients will get inflammation of the tendon below their finger, and they can wake up with a little cystic ball plaque feeling underneath the skin of their palm, and it'll feel discomforting, and they'll have some pain with it, and they'll start to massage it, and they'll go see a physical therapist regarding it. And what happens is this inflammation, this pain, and this nodule will start to get worse, and it'll start to cause bending of their finger. They'll come into their family practice and they'll say, I just woke up one day and I noticed my finger is bent. And this will inhibit the way that they're living their lives. They're unable to get dressed. They're unable to prepare dinner, put their hands in their pocket. And so they're forced with this new normal of what do I do with this scar tissue? It's no different with Peyronie's disease. In fact, the same treatment options for Peyronie's disease exist for trigger finger. So if you want to learn a little bit more about Peyronie's, I think that you should research trigger finger or Dupuytren's contracture. So getting back to the original question, as far as the treatments go, let's talk about the truth about Peyronie's. What are your treatment options? Well, the first option you have is do nothing. Absolutely do nothing. It will get worse with time, unfortunately. But option number one is an option for you. You decide to do that. Option number two, you go see a urologist and you have something called a Xiaflex injection. Xiaflex is the only FDA-approved medication for the treatment of not only Peyronie's disease, but Dupuytren's contracture. Let's talk about Xiaflex. Xiaflex is something called collagenase. This is an enzyme that will actually dismantle collagen. It breaks it down. It breaks down the scar tissue. But what I want you to remember is that this collagenase can't tell the difference between bad collagen and good collagen. So unfortunately, once you inject into this bad tissue, the collagenase will start to seep out into the good tissue. And I've had patients who have lost anywhere from 2 to 3 inches in their length. Very important that you know that. No one's going to tell you that. Your option 3 is surgery. They will go in and they will remove the scar tissue. But what I want you to remember is anytime you have surgery, you are causing injury to the tissue, which creates more scar tissue. And surgery is never 100%. I'm going to repeat that. Never 100%. So just because surgery is an option doesn't mean it's going to resolve that bend or resolve that scar tissue. And then of course, the last option is shockwave therapy. Shockwave therapy is using low intensity extracorporeal sound wave technology. And this is creating microtrauma underneath the tissue, asking the body to dismantle that collagen, rebuild new collagen, bring new blood vessels into the tissue so that you can actually restore the health of the tissue of the penis, you can restore your erections, help the bend, and help the pain. Why would you not choose shockwave therapy first over all of these options? It's non-invasive. There's no surgery. There's no downtime. There's no side effects. If it were me, I would be trying that option first. But like I said, this is your life and you have to choose the right option for you. So if you'd like to learn more about shockwave therapy and how to treat your Peyronie's disease, then give us a call here at the Novus Center. Let us help you on this journey.